Hi, I'm Dr Dee Ripley and I'm the Deputy Chief Scientific Advisor for Health within Welsh Government, and I'm delighted to introduce the shortlisted entrants for the award of Outstanding Achievement by an Allied Health Profession or Healthcare Science Associate, Assistant, Support Worker or Apprentice. The shortlisted entrants in this category are Chris Richards, Physiotherapy Technical Instructor from Hywel Dda University Health Board. Team variant SARS-CoV-2, that's Anastasia Cousins, Eleanor Latham and Josh Dinsmore from Public Health Wales. And Beverly Holdcroft, Outstanding Rehabilitation Coach from Cardiff and Vale University Health Board. Let's hear a little bit more about them.
Hi, my name's Chris Richards and I'm a Physiotherapy Technical Instructor working at Hywel Dda University Health Board. Being an extremely passionate support worker, I joined the Support Worker Reference Group, which was developed by the Chartered Society of Physiotherapy 18 months ago. And our prime objective was to highlight and develop the support worker role. I was one of the members chosen to help create a Facebook group in order to try to help network other support workers and bring ourselves closer together throughout the UK. I have also met with a variety of people within the profession, so we can really highlight and demonstrate the absolutely amazing job we do as support workers. I really feel the work that's been done in the last 18 months, the role has been highlighted, and I continue looking forward into the future, aiming to highlight and develop this role and continue being a passionate support worker within physiotherapy.
Hi, we are Anastasia Cousins,
Eleanor Latham
and Josh Dinsmore, and together we make up Team Variant. We helped in the development of and were in charge of the lab work behind the reflex SARS-2 coronavirus variant PCR. Since the beginning of April, all NHS COVID positive samples have been sent to us for variant typing.
The variant PCR tests for the presence of notable spike G mutations in COVID samples. The combination of mutations that test positive are then compared to known mutation combinations in order to assign each sample a variant identity.
A validation process carried out using over 1,000 samples found that our results had a 99% accuracy when compared with whole genome sequencing, and that we were able to determine variant identity for 40% more samples than sequencing alone, with a much faster turnaround time.
Analysis of our results meant we were able to track the arrival and spread of Delta variant in Wales over time, from the beginning of the third COVID wave until now.
Through this project, we've been able to provide real-time surveillance that has assisted with outbreak management during a time when the emergence of Delta posed a pivotal point in the Welsh pandemic. Our results have informed incident management teams and influenced measures such as enhanced surveillance and surge testing to areas that need it the most.
We know this service has been a useful addition to whole genome sequencing, as we are able to test for variants in samples with a lower viral load, and as variant testing keeps going, the support and data this service provides also continues.
My name is Beverly Holcroft and I've worked for Cardiff and Vale UHB for 31 years as a generic neuro rehab coach. As the pandemic hit, I was working with the community neuro team, delivering rehab groups in the community. We quickly had to adapt our way of working as most of our patients were shielding with conditions that would deteriorate without intervention. Firstly, I recorded my sessions, which were turned into CAV YouTube clips. They were a mixture of education and physical tutorials addressing well-being. We then adapted our group sessions to be delivered virtually, working with Tech Cymru and clinical governance to get going. Our current caseload of patients were then able to access these groups. Then we were able to open up our referral to new patients again. A new group was also developed to address peer support and isolation during the lockdown period. These new skills I've learned were useful in transitioning into my new secondment with the long COVID rehab team. These skills were transferable, helping the team hit the road running. Going forward, I've listened to our patient feedback. Working collaboratively with other services is essential. As we go forward, we look at hybrid working, making our sessions accessible to all.
Congratulations to all three that were shortlisted. What fantastic work. Now on to the winner. The winner really impressed the judging panel by their creativity, their leadership, and also by including patients and the public in their ongoing work. Therefore, I'm delighted to announce that the winner of this category is Beverly Holdcroft from Cardiff and Vale University Health Board. Many, many congratulations.
I would like to say a big thank you and acknowledge the following teams: the Community Brain Injury team, the Community Neuro Rehab team, and currently the Long COVID service. I'd also thank neuro outpatients who I worked with in the pandemic to address all the red tape that we needed to get through to get these groups up and running. This award means so much to me, but really it's for my patients who inspire and motivate me to deliver my best every day. 31 years have flown by, and they say time flies when you're having fun, but I am lucky to have worked in departments that have been supporting, fun and patient focused.